Welcome to our series of learning modules that focuses on the value of research in patient care. Our objective is to educate clinical staff on the scientific method and how to apply it to everyday clinical practice. In this, the first section of Module 3, we will explore some of the most common study designs and the types of analyses associated with those designs. In this module, we will describe common study designs, summarize major differences between the designs, give examples using the clinical questions from Module 2, and consider metrics for statistical and interpretive analysis. There are many quantitative and qualitative methods by which researchers can answer a specific question, and the method that brings the researcher closest to understanding the phenomenon is the most effective pathway to choose. In the health and medical sciences, there are two broad categories of quantitative study design: observational and experimental. Observational studies involve classifying subjects into groups by the presence of an exposure or the presence or absence of a disease. Examples include prospective cohort designs, which follow groups of subjects through time, retrospective cohort designs, which use historical data to make comparisons, and case control designs, which compare a group that has a condition with a group that does not. In contrast, experimental and quasi-experimental studies seek to randomize subjects into groups to maximize statistical balance. A prime example of an experimental study is a randomized controlled trial, with subjects randomly assigned to either a treatment group or a control group. In the realm of qualitative research, phenomenology is a method of inquiry used to interpret a lived experience. The goal is to describe the essence of being in what subjects reveal in an interview. The researcher then presents an interpretation of the observed lived experience. Another method is grounded theory, first articulated by Glaser and Strauss in 1967, and its emphasis is on theory development. That is, theory needs to be grounded in observation, with the goal being the construction of a parsimonious theory with concepts explaining how subjects resolve their basic social problem. One other common method is ethnography. The emphasis of ethnography is on studying an entire culture. Originally, the idea behind ethnography was associated with geographic location, such as going native on a deserted island, but now it's been broadened to include any type of culture. This could be ethnicity, but also a business group or social group. This table presents key differences between common quantitative study designs. A prospective cohort design is appropriate if you want to follow subjects through time or determine if exposure to some condition leads to a particular outcome. A retrospective cohort design, or case control design, is appropriate if you want to use historical data or determine which factors contribute to a known outcome. Although a randomized control trial also involves following subjects through time and determining if exposure to some condition leads to a certain outcome, its defining feature is the random allocation of subjects to treatment and control groups. This table presents key differences between common qualitative study designs. Phenomenology is appropriate if you want to understand a particular phenomenon through subjects' lived experience. Grounded theory is appropriate if you want to build a theory on the resolution of some basic social problem. And ethnography is appropriate if you want to comprehend subjects' behavior in a broader cultural context. In Module 2, our first clinical question focused on the influence of two variables, sodium intake and physical activity, and how a decrease in one and an increase in the other could lead to changes in patient blood pressure. Our hypothesis was that patients who decrease sodium intake and increase exercise will have lower daily and weekly blood pressure. Using a prospective cohort design, we could follow two groups. Group 1, or half of the current patients in a cardiovascular unit, would take in the clinically standard allowance for sodium and would direct their own exercise routine. Group 2, or the other half of the patients in this unit, would take 20% less sodium than the clinical standard and would increase their daily number of physical activities. Once you've determined your study design and identified variables of interest, you must select a method for measuring each variable. But first, you must determine which variable type you are measuring. In quantitative research, there are three common types. A continuous variable can assume any value between its minimum and maximum values, for example, non-integers. A categorical variable assumes values that are names or labels. For example, identity-related attributes like race or occupation. And ordinal variables assume a unique meaning, each one having an ordered relationship to all other values on the scale, for example, the stages in a given process or progression. Now let's consider metrics for our first clinical question. Our primary outcome will be average daily, weekly, and monthly blood pressure. Our secondary outcome will be patient's physical stamina and range of motion. For our primary outcome, we will analyze the continuous variables of average systolic and diastolic blood pressure. We could also graph weekly and monthly averages as a time series. For our secondary outcome, we could analyze the continuous variables of average stamina in minutes and range of motion in degrees. In Module 2, our second clinical question was whether varying exercise types for patients could lead to short and long-term changes in pulmonary function. Our hypothesis was that patients who follow a progressively challenging exercise regimen will exhibit greater pulmonary function over several weeks and months. Using a case control design, we could compare the two groups. Group 1, or patients from a prior year, would not have varied their clinically standard exercise regimen. Group 2, or patients from the current year, will progressively increase the difficulty and duration of their physical activity. Let's consider metrics for this clinical question. Our primary outcome will be average weekly and monthly FEV1 values. Our secondary outcome could be average and weekly SpO2 values. For our primary outcome, we will analyze the categorical variable of average FEV1 as a percentage of a predicted or normal value. For our secondary outcome, we could analyze the categorical variable of average SpO2 as a percentage of oxygen saturation. In Module 2, our third clinical question focused on caregivers' experiences and collaborations when treating patients with lymphoma. Using an ethnographic approach, we could define this group of family caregivers as a culture sharing similar values and perspectives on the care of patients with lymphoma. Qualitative data would primarily include responses recorded during exploratory, open-ended interviews on caregivers' interactions with family members and healthcare professionals. In the next section, we will cover more details about an interpretive analysis for this scenario. Now we'll ask you to reflect on what you've learned. What best describes a retrospective study? A retrospective study involves the collecting of existing or historical data. What best describes a prospective study? A prospective study involves collecting data on subjects going forward through time. True or false? A continuous variable takes on values that are names or labels. The answer is false. A continuous variable can take any value between its minimum value and its maximum value. This education series is made possible by a generous gift from the Stanford University School of Nursing alumni, in collaboration with Stanford Healthcare, Lucile Packard Children's Hospital, and Stanford Medicine. Congratulations! You have completed the first section of Module 3.